This program was made possible with the generous support of the Magnolia of Millbrae. The Magnolia of Millbrae is a senior living community that provides a variety of services and amenities to its residents. For more information, call 650-697-7000 or visit their website at www.themagnolia.com. MCTV thanks them for their support.
Welcome to Wellness Update. My name is Sherry Plambeck. I'm the Director of Sales and Marketing at the Magnolia of Millbrae. We're a senior retirement community located in Millbrae. We offer independent living and assisted living. Today our topic is going to be hypertension, the silent killer. Our guest today is Leonie Wohl. She is a clinical pharmacist, has 35 years of experience in the pharmacy industry. Welcome, Leonie. It's our pleasure to have you here.
Thank you, Sherry, for inviting me today.
Leonie, tell me, what is hypertension?
Hypertension is elevated blood pressure, and depending on the age of the person and the underlying medical conditions, blood pressure readings above 120 on the top number and 80 on the bottom number would be considered to be hypertension.
Let me ask you this, are there different types of hypertension?
Yes, there are different types of hypertension. For example, there is pulmonary hypertension, which would be elevated blood pressure in the system of the lungs. The blood flows through the lungs in one cycle and also through the peripheral vasculature in the other cycle. So if the blood pressure is elevated in the lungs, it can lead to elevated pressure in the lungs, which is pulmonary hypertension.
What is the difference between blood pressure and heart rate? People get very confused on both those. They're trying to know what is the medium that everybody should be. So what's your educated guess?
The blood pressure generally is listed as two numbers. The top number is the systolic blood pressure, and this is the pressure against the arteries of the body when the heart is pumping at its highest. The lower number is called the diastolic pressure, and this is the pressure of the blood vessels when the heart is at rest. The heart rate is the number of beats of the heart per minute.
So what's the average on that heartbeat per minute? For, say, somebody that's between the ages of, say, 20 to 35, and then somebody that is 40 to 60?
We generally like to keep the heart rate between 60 and 80. With certain types of medication, the physician may want the blood pressure, the heart rate to be lower than that. We don't like the heart rate to get too low because, for example, if it gets below 40, then that can interfere with the amount of blood that's getting to the body. So we want to keep the heart rate, in 60 to 80. We don't want it to get too low, and we don't want it to get too high. As far as the blood pressure readings, it does vary. For a normal, healthy 20-year-old, we would be looking at a blood pressure of maybe 120 on 80. As you age, your blood pressure tends to increase gradually with age, so it wouldn't be unusual for a person in their 60s to have a blood pressure 130 in the systolic number. However,
what about the diastolic number?
The diastolic number generally 80 to 85 as you age. Once the blood pressure gets above 140 on the top number, which is the systolic, and greater than 90 on the bottom number, then then we need to be more watchful. A one-time high blood pressure is not of concern. We are looking at a trend. So if the blood pressure continues to be high for several readings, then we need to look at what's causing that. And sometimes it can be lifestyle modification that can help the blood pressure come down. Sometimes it may require medication.
Well, what exactly is high blood pressure and what can that cause?
High blood pressure is a concern when the blood pressure is greater than generally 140 on the top and generally greater than 90 on the bottom for an extended period of time. High blood pressure can put stress on the kidneys. It can also put stress on the circulation to the brain and put you more at risk of kidney disease, stroke, coronary disease, and congestive heart failure.
So, as a citizen out here, how can we arm ourselves with knowledge?
It's very important for each individual to have control of their own health. So things that people can do if they've been told that they have high blood pressure, is to look at their contributing factors, which could be a diet, it could be stress level, it could be salt in the diet, and also other medications that can raise the blood pressure. So all of those things need to be looked at.
What is the type of diet that a person that has moderate to high blood pressure, what should that diet consist of?
We want to look at the amount of salt in the diet, so it's important to be looking at labels on food items and making sure that there's not too much sodium in the diet. Also using the DASH diet, which is lots of grains, not too much saturated fat, lots of fruit and vegetables in the diet would be helpful.
So what about compliance? I know many people can sometimes, the week before they're going to a medical appointment, they're very, very good, and they take their medication the way they're supposed to, etc. But maybe the 4 to 6 months prior to that, they're not doing that. So how do you find the compliance issue is for patients?
Compliance is very important with blood pressure. As with all disease states, we want to make sure that you are taking your blood pressure medications on a regular basis every day. And are
there sometimes more than one blood pressure medication that one would be taking?
Definitely. Most people are not managed with just one type of blood pressure medicine. Generally, to get to target goals of blood pressure, multiple medications will be needed. And the reason for that is that the medications work in different ways and they work in synergy, so they help each other, and that helps to reduce the blood pressure and keep it at target.
So what other medications would that be? Would it be like a potassium, water pill?
There are different classes of medication. For example, there can be diuretic, which reduces the amount of fluid in that the body has to deal with. It can be beta blockers, which reduce the heart rate and put less stress on the heart. Other classes of medication include the ACE inhibitors, calcium channel blockers, and sometimes some medications that adjust the rate of the heart or the strength of the beating of the heart.
Let me ask you this. In most cases, is the primary prescription that the physician writes, is that exactly the right script for that individual, or is it basically trial and error?
Certain patients, a certain type of medication is more appropriate for them. For example, an African American generally respond better to the thiazide diuretics. But with regard to medication, the physician generally will start someone on a medication and then follow up in a month to see how that medication is tolerated, if it's brought the blood pressure down sufficiently, and then he may adjust the dose of those medications or may add an additional medication, so that they want to reach the target range, target goal, and keep the blood pressure below that target range.
And while this is going on, is there an exercise regimen that the patient is supposed to be following as well?
It's important for patients to be active and exercise on a regular basis, but that would need to be checked out with the physician to make sure that the exercise program is compatible with the patient's overall medical conditions.
Now let's discuss stress. In this day and age, everybody's so into electronics. They're run. Nobody has time to do anything. Everybody has to check that cell phone. They've just got to check those voice messages constantly. I'm not sure that all of these electronics are really helping us live a less stressful life. And I know stress can be a big factor in hypertension. So how can we combat that?
Each individual needs to look at their own stress level. Technology can be used in a positive way to be more organized and reduce stress. So we need to look at that. We need to make sure that we have times when we disconnect from technology to give ourselves time to just relax.
And how do you do that?
You can set aside a time after I get home from work, I turn off my electronics so that I just have a time where I can just be in the moment. And meditation...
What if you're a mother and you have 4 children? 2 need to go to soccer, 1 doesn't feel well, and the other one needs to have dinner quickly. How do you de-stress from all of that? This is so current nowadays.
Sometimes IT can help with that, in that you can use your IT to schedule different components of your life so that things are more in balance. But it's definitely important to set aside some time, some downtime that's just for yourself.
And what about mindfulness stress reduction? How does that work? Tell me about that.
I think that mindfulness stress relaxation just helps you to take a breath, just let everything go. And
much easier said than done, don't you think?
It's much easier said than done, but with practice, I think practice makes perfect. So the more that you do it, the easier it becomes, and I think that that can help overall for the long term, decreasing stress, and does help to keep the blood pressure better controlled.
Now, what about patient education? I mean, we have so much access to everything on the internet nowadays, it's almost frightening because you can really self-diagnose yourself, and that's not always a good thing to do. Mm-hmm. So what self-education is there out there for the public when they want to gain more knowledge on hypertension?
Oh, there's a multitude of information on the internet about hypertension, but it's important to work with your physician, because your physician is the professional that will set the target goal that is correct for you based on your age and your underlying medical conditions, because the target ranges do vary according to your age as well as your underlying conditions such as diabetes or kidney disease. Also, it's important that you work with your physician as far as follow-up labs, because you need to keep an eye on your kidney function when you're on medication, as well as your potassium and other lab results when you're on blood pressure medication.
Now, the subject of weight and exercise, I think every time a person goes to their internal medicine doc, they always say, and you need to exercise, and you need to have a heart healthy diet. So tell me about that exercise. What can people do, say, if they're not very mobile? Mm-hmm.
I think any activity is good, and you need to try to choose an activity that works with you. You can, if you're not very mobile, you can do chair exercises, or just basic stretching using stretch bands. But I think setting yourself a goal and setting yourself an expectation that I'm going to exercise, taking it in small steps, maybe starting with a small goal and then building upon that. But I think the more exercise you get and the more consistent it is, the better your blood pressure control will be.
So should that be a daily schedule then?
I think so. Yes.
Even if you have another function that you need to go to and you really don't have time to exercise, should you still try to make the time during the course of the day?
I think you can vary the time a little bit, and occasionally you can take some time off, but I think to be consistent, I think it's important that you set yourself a regular schedule of exercise just to keep your blood flowing and also keep your weight under control.
Now, what if somebody is depressed and now they've been diagnosed with hypertension, so they're automatically thinking, oh, this is the silent killer?
Hypertension is something that is a chronic disease and causes damage over a long period of time. So if your blood pressure is high on a one-time basis, it's not cause for immediate concern. We're looking at consistent high blood pressure. So if you are diagnosed with hypertension, you need to know that it is manageable, that with the proper medications and with good compliance, blood pressure is able to be well controlled, and you can definitely make a positive intervention in your own health by keeping your blood pressure under control. As far as if you feel depressed about having high blood pressure, I think knowing that your blood pressure is controllable, it is something that you can work on yourself to manage, gives you a feeling of being in control. And so hopefully that can help to decrease feelings of depression about
So if somebody is on high blood pressure medication, can they get off of it with proper dietary control, exercise, attitude?
Some people can. Some people can, but most people do need to be on long-term medication. If you are very overweight and you have no exercise in your diet and you're on a high salt diet and you make significant lifestyle changes, it is possible for your blood pressure to be reduced, and maybe a trial off the blood pressure medicine may be possible, but most people do stay on blood pressure medications long term. What's
the best way to get a good blood pressure reading? How does one do that?
Generally, during a physician's appointment, they will check your blood pressure with their in-office blood pressure machine.
Is that similar to this type of machine that you've brought with you today?
Today I brought with me an automatic blood pressure machine. Generally, the physician's office has a different type of machine, but this is a type of machine that can be used to supplement the physician's readings and can be easily done at home. For example, this blood pressure machine is easily purchased at any store and has a self-inflated cuff. If we talk about blood pressure readings at home, we like to have the patient or the person sit for 5 minutes before taking their blood pressure. And we want to make sure that the cuff is the correct size, and when you purchase the blood pressure machine, the personnel at the store can help you with sizing the cuff. The cuff is generally positioned in the upper arm, and generally we want the arm to be supported, resting gently at heart level. Generally we want to have the tubes that come out on the inside of the arm, and then just rest for 5 minutes before you start the machine, and then set the machine. The machine will inflate to a certain level and then start to deflate, and then as it's deflating, it's checking the change in the pulse and the heart rate as it goes down. So you'll get a reading from your machine at the end. If your reading is very high, it can be because you're just concerned, first time I'm using the machine. So I recommend, if the blood pressure is greater than high, greater than 150 and greater than 90, to check it again. But we want to make sure that you have a rest period between taking the first reading and then taking a supplemental reading. So wait 5 minutes, be relaxed, take a few deep breaths, reposition the cuff on your arm, and take a second reading.
I know sometimes what happens is a lot of people, when they're going to their physician, they're so anxious they get that white coat syndrome,
right.
And I think that can really affect a lot of people.
It's
Do you
true.
think the physicians take that into account
Generally,
when they're taking the blood pressure?
Generally, a physician will note that in his records, and if a patient does tend to get very anxious and at the physician's office, they will generally make sure that the patient has waited 5 or 10 minutes before they take their blood pressure, and if it's high, they will generally take the blood pressure again at the end of the physician visit. With the home blood pressure kits, this can actually be an advantage because you can do your blood pressure at a time when you are less stressed, and hopefully your reading will be more accurate and more in tune with your average blood pressure readings.
Now, what about the thumb method of using the thumb or the finger? I believe it's the index finger for
Right.
blood pressure monitoring. Is that as accurate as, say, this type of?
The upper arm
Cuff here?
cuff is considered to be more favourable, but if the finger blood pressure machine is all that you have, that's fine. We're just trying to get an idea of the average blood pressure if it's high. So either one, but the preference would be the upper arm machine.
So there's no particular time of the day to take blood pressure where it might be perhaps a little bit lower?
It's important for your blood pressure to be taken at the same time of the day each day if you're recording it, so that we get an accurate picture of the blood pressure at a certain time of day. Most people do take their blood pressure in the morning, and they can take it like 1 or 2 hours after they've had their blood pressure medicines to see if see how the blood pressure medicine is working, and keep a record of it. Bring the record to the physician's appointment at each visit. However, if the blood pressure is very high, it's important to keep an eye on that. If the blood pressure is greater than 180 on the top, the systolic blood pressure, or greater than 110, the diastolic pressure, then that would be an emergency situation where you would go to the ER.
And you would just go immediately then? You wouldn't even think twice about that?
No.
So there are ways that we can really arm ourselves to help prevent this epidemic,
Definitely.
because a silent killer is not a good thing for any of us.
Well, 1 in 3 people in America do have high blood pressure, and most people do not realize they have high blood pressure because it is something that we're not aware of on a daily basis. Generally, it will be at a physician's office visit that we realize that our blood pressure is a little elevated, and then generally the physician will have make another appointment to come back and recheck it, because we want to make sure it is pressure is elevated on a more than just a one-time basis.
So it's recommended then for people to keep a record
Yes.
a couple of times a day, same time every day, is that?
I recommend same time every day so that we have a consistent time of the day, and so we can check that against the yesterday's reading at the same time. Generally we can keep a record and then take this with us to each physician's appointment. If we're taking medications, for example, if it's twice a day, generally we space those out 10 to 12 hours apart. 3 times a day would be every 6 to 8 hours, and 4 times a day would be every 4 hours.
Okay, so...
3 times a day would be every 6 to 8 hours,
Okay.
and 4 times a day would be every 4 to 6 hours.
So the patient can do that.
Mm-hmm.
And I know we discussed the lifestyle and how important that is, exercise, taking the medication at the right time of the day, certainly having the heart-healthy diet. What about the issue of alcohol? Does that play into this at all? They say red wine is good for everybody every day.
In moderation. I think excess alcohol can be a negative factor in hypertension, so we need to keep that under control. So limiting excess alcohol is definitely helpful.
So is there a particular number for males versus females? Is red wine better, white wine, or straight alcohol? What's the key there?
We want to keep the number of glasses for a woman is different for a man. So for a woman, I think it's 1 or 2 glasses maximum for a woman, and 3 glasses maximum for a man per day.
And that's in a time frame of, say, 4 to 5 hours?
Yes.
Okay, so 4 to 5 hours. Okay, so now we know exactly what we have to do to stop this epidemic of a silent killer, because it's very frightening to think that you could be sitting in a room, 1 in 3 people in this country are going to have high blood pressure. That's very frightening when you look at the whole population.
That's true. Very true.
So we need to follow the heart-healthy diet, the exercise, limit the alcohol to an extent, and just take it one step at a time, but certainly try to be taking the blood pressure every day, write it down twice a day, and then still keep up with all of these electronics and not have any stress, which can create tremendous hypertension, I think, just in general. Don't you agree?
Definitely, definitely. And then for everyone to take an active role in keeping an eye on their health, and if you do notice that you have high blood pressure, keeping it under control, using all of those factors to manage it. And with proper management, blood pressure is a manageable condition, and we can live a long, healthy life.
So if we follow those steps, we can live a long, healthy life and hopefully prevent that silent killer from getting the best of us. I want to thank you so much, Leonie, for coming to visit with us today and for you sharing your knowledge. If anybody has any questions from Leonie, they can certainly contact her at eldercareconsult@aol.com. And if you have any questions for me, you can certainly check our website out, www.themagnolia.com, or you can email me, splambeck@themagnolia.com. I thank you all so much for taking the time out of your busy schedules to share a few moments with us on Wellness Update. Live each day. Life is so very, very precious.
Thank you, Sherry, for having me today.
My pleasure.
This program was made possible with the generous support of the Magnolia of Millbrae. The Magnolia of Millbrae is a senior living community that provides a variety of services and amenities to its residents. For more information, call 650-697-7000 or visit their website at www.themagnolia.com. MCTV thanks them for their support.